My name is Prue Cormie. I'm an accredited exercise physiologist. I'm a principal research fellow at Australian Catholic University, and I work clinically at a number of different hospitals as well as leading ex-med cancer. My primary area of interest is using exercise as a medicine to help people with cancer enhance their lives. So our work is very much focused on understanding how we can use exercise to help prevent and manage treatment-related side effects associated with cancer. I suppose the biggest advancement in the field recently has really been the level of recognition that exercise now has. Exercise is being viewed as an adjunct therapy that should be incorporated as a standard component of cancer care. So in much the same way that the specialists are recommending a number of different treatments, we should be thinking about exercise as part of a standard routine part of cancer management, specifically to use exercise to help counteract the side effects of those primary treatments. We now have a position statement from the Clinical Oncology Society of Australia, which has been endorsed by 25 of Australia's leading health organisations, specifically saying that exercise should be viewed as a standard component of cancer care. So all members of the multidisciplinary cancer healthcare team actually recommend exercise, so recommend you to be physically active as much as your current conditions and abilities allow, and to progress towards evidence-based exercise guidelines. And then for best practice care to actually include referral to an accredited exercise physiologist or physiotherapist with experience in cancer care. I would highly recommend to all people with blood cancers to view exercise as something that you can control in your cancer treatment. It's something that you can actively do to participate in the care of your cancer. And it's something that you can use to help prevent and minimise the severity of any kind of side effects you may be experiencing. So I would strongly encourage all people to view exercise as a standard component of their care. So exercise is probably the best medicine someone with cancer can take in addition to their standard cancer therapies. And that's because we know from research evidence that exercise helps minimise the side effects associated with cancer and its treatment. We know people who exercise during and after their cancer treatment experience less physical functional declines, less cancer-related fatigue, they have less psychological distress, better mental wellbeing, and they have overall improvements in their quality of life. So even if you're experiencing really severe side effects and side effects that maybe you think would limit your ability to participate in exercise, seeing an accredited exercise physiologist allows you to really do exercise in a way that doesn't exacerbate those symptoms and helps you exercise in a way that minimises the impact of those symptoms on your everyday life. So even if you have really bad symptoms, exercise can be a very effective medicine for you, and it can be tailored to you so that you can exercise despite those symptoms. There's a lot of information out there about exercise, and sometimes it can be really confusing about knowing what exercise to do. Now, what exercise doesn't matter so much, but the quality of the exercise really matters. So it doesn't matter what you're doing, but if you're doing it in a safe and effective way, then you're going to get benefits from that. The intensity or how hard the exercise is a key factor in actually influencing the magnitude of response that you get or how much benefit you get from that exercise. So we really want to encourage you to be working at a moderate intensity. So that's, if I asked you how difficult that was, it's between somewhat hard to hard. You have to be puffing, sweating, your heart is beating faster, and that's typically what a moderate intensity is. So it doesn't matter if that's walking or riding a bike or swimming or lifting weights or doing the gardening. If you're doing it at a moderate intensity, that's something that's going to give you the best benefit.